Hi, I'm Sue Martin. I'm a palliative care nurse consultant with the North Simcoe Muskoka Hospice Palliative Care Network. I'm speaking to you about a palliative approach to care. So what do you think of when you hear the words palliative care? We've had many different responses to this, and I'm hoping that after listening to this education piece, your understanding of what a palliative approach to care will be clearer. The World Health Organization's definition of a palliative approach to care is that it's an approach that improves the quality of life of patients and their families facing the problem associated with life-threatening illness through the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems, physical, psychosocial, and spiritual. So what does that mean? Well, it's the way we care for people who have a life-limiting illness. It focuses on providing good quality of life through great symptom management. It's a holistic approach. It can include active therapies, and the patient and the family are at the center of care. We talk about early identification, and we use a question, the surprise question, to aid us in understanding when it is appropriate to initiate this palliative approach to care. So the surprise question is, would you be surprised if this person died in the next year? If you answer no, I wouldn't be surprised, then it would be appropriate to initiate a palliative approach to care. Some principles of a palliative approach are to relieve suffering and improve the quality of life for persons who are living with or dying from advanced illness or are bereaved. A life-limiting illness could be an acute diagnosis, it could be a type of cancer, or it could be a chronic disease such as congestive heart failure, COPD, or renal disease. Our aim is to support the patient to live well until they die. We provide comfort and dignity for the person living with the illness, as well as the best quality of life for both the person and their family. And family is whoever the person says that family is. Palliative approach offers a support system to help the family cope during the patient's illness and in their own bereavement. It's available for people living with any illness at any age and at any stage of illness. It's best initiated early in the disease trajectory, and the earlier the implementation of a palliative approach to care, the better the outcome. And there has been research to prove that. Palliative care can be provided by specialist and non-specialist clinicians. It's an approach. Many people require primary level or generalist level palliative care providers, and a small number of patients with complex needs occasionally require assistance from a specialist palliative team for consultation or for shared care. A palliative approach works in conjunction with other therapies that are sometimes intended to prolong life, and if that is the patient's wish, for instance, chemotherapy or radiation, and it can include investigation to better understand and manage the symptoms. And some of those symptoms might be nausea, pain, anxiety, depression, difficulty breathing. A palliative approach to care is a holistic approach. It provides social, psychological, spiritual, and emotional support. So we talk about the 8 domains of care. And we understand that those 8 domains are what we base our care around: physical, psychological, social, spiritual, practical, end-of-life care and death management, loss and grief, and disease management. It's a multidisciplinary approach. The multidisciplinary team works together to prevent issues and anticipate problems due to the illness and not to react at the last minute. So we want to be proactive. Quality hospice palliative care neither hastens death nor prolongs life or suffering. It affirms life and regards dying as a natural process. So this is the spectrum of care, and the picture has been adopted from the Model to Guide Hospice Palliative Care. It shows the relationship of palliative care and restorative care, or therapy to modify disease. It demonstrates how offering both types of care concurrently can really create a robust model of care for the patient, and it offers quality of life and pain and symptom management alongside other therapies. So this picture illustrates the full spectrum or approach, and within that it depicts the period which includes end of life. So the lower blue triangle represents palliative care. The top blue triangle represents therapy to modify disease. And so on the left-hand side, when a person is first diagnosed with a life-limiting illness, or perhaps a person has gone in, admitted into long-term care, they would benefit from a small amount of palliative care and a larger amount of therapy to modify disease. And that might include things like blood work or blood transfusions, dialysis, chemotherapy, or radiation therapy. And as time goes on and the disease progresses, the amount of palliative care required increases, and the amount of interventions or therapy to modify disease generally decreases. It includes the end of life period as well, and then after death, it includes the bereavement for the family. This picture depicts the importance of the multidisciplinary team and the fact that the patient and family are in the center of care. So hospice palliative care versus end-of-life care, what's the difference? So the big picture is a palliative approach to care, and within it we have the end-of-life piece and the palliative care piece. So in a palliative approach to care, we promote advanced care planning and conversations around goals of care. It's an approach to relieve suffering and improve quality of living and dying. It addresses issues and optimizes symptom management in all those domains of care that I talked about. And patients, families, and staff are supported in their grief and loss. Palliative care begins at the point of diagnosis of a life-threatening illness, and we use the surprise question, is death expected in the next year, to help us determine when is it appropriate to initiate a palliative approach to care. It's active care which complements the disease-modifying or restorative therapy. Now, end-of-life care is when death is expected, usually within 3 months. It's the final stages in a palliative approach. Often death is we're talking days to weeks rather than months to years. End-of-life is a component of palliative care. And remember, please remember that the patient is not palliative. That's the type of care that they receive, and we don't deem people palliative. We screen using various gold standard tools. And these are some of the tools that we use: the domains of care, the disease trajectories. Gold standard framework is another tool we use. The ESAS, the PPS, clinical frailty scale, the MDS-RI, SPIC tool, and the FICA. And we'll be providing more education around these tools as well. The benefits of incorporating a palliative approach to care. Well, it really improves and it creates, it helps to standardize practice across all the healthcare sectors, and it creates an early baseline that aids in determining trajectory. It opens the door for continuous care planning and medical decision-making conversations. Those conversations are so important. It creates an environment that's culture-changing, actually, where it's safe and normal to discuss sensitive issues around care provision and end-of-life care for patients and for families and the care team. It improves the overall quality of life and quality of care. So how do you provide great care? Be self-aware. We have a lot of experiences that we bring with us, so it's important to be aware of how we're feeling. Include the patient in developing a plan of care. Understand what the patient wants. Most importantly, they want dignity and respect, perhaps great symptom management, but it's the conversations that are so important to have and understand what they want in developing a plan of care. Use your gold standard tools to remember what those tools are that you have at hand. And consult your supports. Remember, it's a multidisciplinary approach. This is the information about the Palliative Care Network. We have 10 palliative care nurse consultants throughout the regions of North Simcoe, Muskoka, and a referral can be found on our website. A quote by Dame Cecile Saunders that really resonates with me: how people die remains in the memory of those who live on. Some references, and I thank you for joining.